Hi, this is Sunil Manji, Senior Principal Solution Architect at Elastic. I'm doing a quick demonstration on a demo that was really inspired by my wife, who's in the medical industry. So oftentimes our physicians see a lot of patients and they don't have a history, right? Think about the emergency room. They just walk in and they may have never seen the patient before, and they need to have a quick diagnosis of what's happened in the past. And this example of being able to interface, or I often call dialogue with your data, oftentimes it requires a sophisticated search engine. And you want the engine to give you the right answer, the relevant answer. It's absolutely important that when we're interfacing and we're basing our judgments on what the interactions are, that the context provided to our chatbots is relevant and it is the right answer. So let's take an example of what this would possibly look like in a clinical insights hub. Here, I'm going to pretend that I'm a doctor and the patient has come in and has a diagnosis that I have to go approach and possibly prescribe her some medication. So let's take a look at what this interaction will look like.
Patient name, please.
Gloria Smith.
Patient is a 43-year-old female with allergies and asthma, hypertension, high cholesterol, dry eyes, obesity-related comorbidities, pancreatitis, and suspected benign kidney lesions. Recently experienced dizziness. Prescribed meclizine and Nasonex. Follow-up recommended for various health concerns.
Okay, so I got a quick summary, but I want to know a little bit more. Summarize her last 2 clinical visits.
On April 24, 2024, Gloria Smith reported dizziness and was prescribed meclizine for presumptive benign positional vertigo. On February 2, 2024, she received an MRI revealing suspected benign kidney lesions and was referred to a nephrologist for further evaluation.
Okay, so I have a quick summary. Now, let's say that the patient is, I'm going to pretend to be doctor, and they're again complaining about dizziness, and I'm going to prescribe, let's say, an opioid, right? So let's take a look at if there's a challenge with that. The patient is again complaining of dizziness. I'm going to prescribe her opioid. Does that interact with any existing medication she is taking?
Meclizine and any opioids do not interact well. Gloria Smith is currently taking meclizine for her dizziness, and thus, prescribing her an opioid is not recommended. Please consult further on alternative treatment options.
Okay, so I understand that's probably not the right approach. Again, I'm just playing doctor here. So I got it, right? So now the last thing I want to do is, let's say I'm going to go and tell her to go off on her way. I'm going to discharge her, right? So I want to add that to the file. Create a medical record. She has been discharged and was complaining about dizziness. At this point, we can no longer prescribe her any medication.
I have added a record to the patient's file. Visit date, May 1st, 2024. Medical record.
Okay, so we've created a medical record for her, so we're able to interface. It just makes it easy for the physician to have a conversation with the bot. And this could be a text or an avatar or a voice interface. But at the end of the day, what are we getting at? In order to have this kind of sophistication, regardless of the interface, you need to have the right context, right? The right answer. And that requires a highly intelligent search AI engine, and that's Elasticsearch. So what we've done here is we've been able to provide that context to our avatar bot. Our avatar bot is able to say, okay, I know who the patient is. Now you can have that intelligent interface, right? And again, the underpinning of all of this is Elasticsearch. Thanks for watching. Hope you enjoyed that.